Hi, everybody. I thought it would be helpful if we did an Instagram Live with Dr. Jake Deutsch, who is going to be joining us. Sorry, Jake, that I'm a little bit late. I was watching coverage of the president getting released from Walter Reed and going back to the White House. And let's see, here's Jake here. Getting pretty good at this, everybody. Anyway, I thought it would be helpful to talk to a physician. Not really. I look like hell, I think. Hi, Jake. How are you?
Hey, Katie, good. How are you doing?
Can you hear me?
I can hear you.
I'm
Can you?
good, thank you.
Yeah, good.
Thanks so much for joining us. Can you hear me okay? And can you see me okay? Hmm. I think. How about you guys? Are you all being
That should be better.
okay? Good. You were just frozen, but now you're not, Jake.
I'm
Thanks so
moving.
much for doing this. I just watched something pretty extraordinary, and I have real mixed feelings about networks pretty much handing their entire evening newscasts over to this, really, this display of what the president is hoping to project strength to the nation that he, faced COVID and won.
Hmm.
And basically, the entire half hour of every evening newscast was co opted by him leaving Walter Reed and taking a chopper back to the White House and posing and waving with some American flags on either side of him. I mean, I think, sort of theatrics aside, I thought we should talk a little bit about what happened and the president's day at Walter Reed. And I'm going to charge my phone with another charger. I don't know. Chargers are like the new socks. I lose chargers all the time.
I
But
know.
Jake, I wanted to talk to you about everything that has gone on this weekend and get your medical expertise so we can kind of talk to people who are watching and they can totally understand sort of what the hell is going on. I mean, here we have something like 30 people with the White House who have connections to the White House who have now been infected by COVID. We've got a lot of questions about the kind of drugs he was administered, about his tests, when it was taken. Anyway, so many questions, Jake, and
I'm ready.
I've been taking a breath. And everybody, if you guys have a question for Jake or something that you need to understand better, please just ask me in the comments, and I will then talk to Jake about it because it's just unbelievable. Okay,
Unbelievable.
I'm going to stop talking. First of all, what did you think of this spectacle of the president leaving Walter Reed? And after just 3 days, who knows when he was exactly diagnosed, but what did you make of that, Jake?
To me, it's all about mixed messages. So, the problem with the handling of the COVID pandemic from its onset with the United States has been there haven't been clear directions. And here, the person of highest power becomes sick with COVID, which is in itself shocking so late in the game. But, it is possible. But given the fact that he actually gets sick so late, again, it's mixed messages. What does that tell the American people? That if you have COVID, you should check yourself into the hospital with just a fever. You should try experimental medications. Even just the recklessness of about wearing masks. It all goes back to those mixed messages. Just a week ago, he was taunting in the debate about wearing masks if you're 200 feet apart. I mean, masks should be used no matter what the circumstances because we know that they work. So, this has become more of a political agenda than health information. And that, as that's what concerns me the most as a physician. It's not real health information. It's happenstance. We see him relying on physicians when he goes to the hospital, the best experts, but the experts that he had been using to give us information and direct us, he pushed aside before he got sick. So I guess the key take home in my mind is mixed signals, misinformation, just bad direction in general.
And for all those people who are accusing us of having bias, I want to say we are reporting the facts that he basically co-opted every network newscast. He planned his leaving Walter Reed to happen at 6:30. So I'm sorry, everyone who thinks that or anyone who thinks that. We're telling you what happened, and that's the way it is. So let's continue this conversation. And if, people don't want to watch it, they don't have to watch. Let's talk about what the president was being administered. He was getting a monoclonal antibody, which you can
Hmm.
explain, as well as steroids,
Hmm.
and really this whole cocktail of drugs, which was quite unusual for the kind of treatment normally you would be given. It's sort of a kitchen sink approach. Talk to me about the kind of medications or drugs he was getting and how you felt about that or how you interpreted that.
Yeah, so just first and foremost, I would like to mention that, sorry, got a almond in my throat. I am an ER physician, and I've treated thousands of patients who have had COVID. So I think that that's important to put into some perspective here, as you
I
know,
agree. Thank
we have
you.
this discussion. But that being said, this treatment goes off of normal for what we were being led to believe his condition. So highly experimental medications, the remdesivir, which is an antiviral medication, is being used for people who are really very sick and have significant inflammatory processes, including lung inflammation. So that medication is only been proven to reduce the duration of stay in the hospital, but has no clinical benefit in reducing mortality or death. So that's one of the medications he received, and it's actually quite associated with kidney problems. The second medication, which is the monoclonal antibodies, is still considered a bit experimental. There are studies going on using these in nursing homes, which are looking to be promising because they're trying to identify the sickest people who need it the most, who potentially would have a bad outcome, and administering these. And that's really where that type of therapy lies. But it hasn't been recommended in any purpose for people who have mild symptoms, which is what was reported for the President Trump. And to just explain that a little bit, antibodies that are given, this monoclonal antibodies, it's basically bypassing the vaccination step. So when we get a vaccine, we have a little piece of the virus that goes into our body, and then we build antibodies, which takes time. So we're bypassing that step where we have to build the antibodies. We're actually getting a dose of antibodies intravenously. It's an infusion. So again, not the mainstay of treatment, certainly not recommended for people who have mild symptoms as it was described, and this abundance of caution that was being described, I think is the safety catch to justify these exhaustive measures, and necessarily aren't medically indicated. And then the steroids, the third medication, have been reserved again for people who are critically ill. It's been proven to be effective for people who are in the ICU, who are on ventilators, who have really lost the sense of fighting this on their own, having organ failure, and those are administered. Steroids are powerful anti-inflammatory drugs. So we're talking about three experimental treatments, with many we don't know the side effects, because we're obviously trying to give everything to the president. They were trying to do whatever is possible. But in medicine, you don't throw the kitchen sink at a problem when things are going well. You do that when things are really turning for the worse. So there's a lot of misinformation in my mind between what was being done and what we were being told about his condition.
Well, it was very interesting to me that his doctor, uh, you know, s- came out on Sunday and said basically, I was kind of giving a rosy scenario, or I was giving information because I wanted to. For anyone who missed, this is my friend, Dr. Jake Deutsch, who is a ER physician who's treated a lot of people with COVID. And we're just talking basically about what's going on with President Trump and the fact that he left the hospital and all kinds of questions that are very confusing, I think, for the American public. And one of the things I was going to ask you is I noticed that his doctor said, he wanted to give a positive thing to lift his spirits, which is absolutely ludicrous, by the way. He
Yeah.
has an obligation to inform the American public how the president is doing. He's not there to basically be, as someone just said, a spin
Hmm.
doctor.
Hmm.
So he did say today there's some HIPAA regulations that prevent him from being completely open and honest with the American people about the president's condition. Is that true, Jake? Are there some things, for example, someone asked about his lung scans and to
Hmm.
see if his COVID caused any lung damage, because we know that can happen with the cytokine storm when the immune system gets, in overdrive to fight the virus. And it's in fact your immune response that's often doing a lot of damage to vital organs. So is there something with HIPAA that would prevent him from sharing this information?
Well, the president, like any other individual, has a right to privacy when it comes to his medical care, and that's really what HIPAA regulations are enforcing. However, we would expect that he's given clear direction to his physician that's speaking to the American public on his behalf to provide the most accurate information without tainting the picture in order to make people have a confidence that's not really based on the science. So, I don't agree that he should be painting a rosy picture. He should be painting a picture of medical facts and information, simplifying it, of course, for the American people, because this is complicated. But I agree, not with, it seems to be that there was withholding information about critical details, most specifically what his oxygen levels were, what his results from diagnostic tests like x-rays and CAT scans showed, and what other potential complications he could have been diagnosed with. Did he have a diagnosis of pneumonia? Has he had problems with his kidneys? Have they seen any vascular complications? I mean, we got to remember the complications of COVID go beyond respiratory. The strokes, the DVTs, which are blood clots in your legs. These are real kidney problems, other infections that piggyback on the COVID infection. Those are that's the information that we didn't get any truth to.
But Jake, in the president's defense, and I want to talk about something called VIP syndrome in a moment, which I'm very familiar with. When my husband was colon cancer, I had to be kind of on guard for that. But, they have learned a lot about treatment. And is it possible that the president got treatment that just was not known to doctors early during the pandemic, but they are much more equipped? Doctors like you, well, you'd be the perfect person to ask. Don't you guys have a better idea about how to help people when they have this disease, to give oxygen faster, to prevent people from going on ventilators? I always pronounce the drug wrong.
Remdesivir.
Thank you. That's a very difficult drug to pronounce, but that if you administer that early, now they know about blood clots that they know about. So is it possible that they were able to get him, in better shape much faster than people might realize?
Yeah, possible, but also a bit suspect, given the fact that we were told that he had a mild expression of the disease. When we were told that his oxygen level dipped down to 94%, in my mind, that's a red flag, because those numbers don't change moment to moment. When they go down, there's a reason. There's an infection, there's inflammation, there's fluid, there's something that's blocking the gas permutation, to get oxygen into the bloodstream.
Yeah.
So, to me, that just doesn't ring true. So yes, those treatments could have led to a faster recovery than we'd expect. But again, this is all experimental. And my concern as a physician, and having dealt with number of questions from people requesting whether they should be taking the hydroxychloroquine, is that once the president says, I endorse this or I recommend this, people try to do exactly the same. And I think we're going to see a cascade of people trying to procure these medications, even though it may not be indicated. And it potentially leads to a dangerous situation, no different than people not wearing masks. I think that's an even more important and applicable scenario that he has to take responsibility for.
Yeah, Jake, I was going to ask you about now that he's back. So let's say he was diagnosed on Thursday, which I guess is the best case scenario, that people are saying he was diagnosed on Thursday. Who knows the exact timing? They haven't been transparent about that, about, when he was tested and when he found out. I think he had that Abbott fast test, and had, I guess, that was even more reliable. Anyway, be that what it may, it's Monday today. So
it hasn't even been a week.
Right.
It hasn't been a full week.
Shouldn't he be quarantining now for, I guess, what, 10 more
So,
days possibly,
well,
right?
well, 10 days if it's a mild to moderate infection, more if there was a more severe illness, because that really speaks to the fact that there might be higher viral load. In his situation, we're not even at a week. So, of course, he should be quarantining, and he shouldn't most certainly be taking off a mask like he just did when he exited the helicopter. There was almost symbolic that he was trying to tell people that you don't need to really wear masks. But really, more importantly, medically, what we see is this kind of critical window at day 7. So,
Somebody, I'm glad you brought that up because somebody, one of my smart followers, I have a lot of smart followers, asked about that critical day 8. So it's day 7, 8,
right,
after
a week.
a week after you've been infected. That is sort of that all important window.
Yeah. So, having treated many patients, this was something that I saw time and time again with them. I personally saw that when I had COVID. And, for the first week, I felt a little bit under the weather. I had low-grade temperatures. I was functioning, but I certainly wasn't in great shape. Day 7, day 8, I woke up and I said, something is not right. And that's what I've seen time and time again with patients is that.
You actually went to the hospital.
Right. So I felt significant change in my condition. I felt chest pain. I went to the hospital, was diagnosed with pneumonia on both sides, what we call bilateral pneumonia. But luckily, my oxygen level didn't go down. So I have to just go back to that point about the president's oxygenation. We're being reported that it went down to 94%. He doesn't have any reported underlying lung disease. What's going on there? And if he's already having some concerning symptoms at day 4, day 5, day 7, day 8 is going to be really critical. And I'm led to believe that he isn't out of the woods, but they're trying to continue his treatment, his therapy at home in order to, minimize the backlash that he's sicker than he is. And really time is going to tell.
Yeah, I guess we just have to watch. Meanwhile, as I mentioned, 30 people affiliated in some way, shape, or form with the White House, 3 Republican senators, I think 3 journalists, obviously Kayleigh McEnany, Hope Hicks, on and on and on, Chris Christie. All these people have been diagnosed. We have a whole list here. President Trump, Melania Trump, Kayleigh McEnany, Carolyn Levitt. I don't know some of these people. Hope Hicks, Kellyanne Conway, Chris Christie. 3 Republican senators, as I mentioned.
Numerous members of the press corps.
Yeah, 3. I said 3 reporters. I mean,
Mm-hmm.
so and there hasn't been any contact tracing. Apparently, the CDC. I'm sorry. I hate when people say stop your bias, Katie, because you know what? We're reporting the facts. So stay with us if you want, but don't watch if you think that. So basically, there's been the CDC has offered their services for contact tracing, but the White House has not actually taken them off on the offer, taken them up about contact tracing and what you think should be done, because the president went to a rally in Minnesota
Mm-hmm.
and a mask. He was at a fundraiser in Bedford without a mask at his
Mm-hmm.
club, right? And so, he has potentially exposed many people, not to mention the ripple effect of the number of people who also have been exposed and the fact that they are exposing other people potentially. So what ideally should be done, Jake, to protect other people from getting this?
Everybody who's tested positive needs to give a full account of anybody that they've been in contact with, close contact, meaning no mask or, intimate level of contact, and they need to be tested as well. So my heart wants to believe that the White House is doing this and they want to just do it on their own. And that's fine. But obviously, denying the CDC to assist makes it a bit concerning that there's something that they're hiding. Again, we haven't also learned when the president had his last negative test. So we don't have a clear timeline. And I think some of the contact tracing is going to identify what that timeline looks like. So, there's a lot of concerning elements about that as well, as far as I'm concerned.
I think there was a lot of people think this was faked. I really can't imagine that to be true, that the president didn't have it, that he's looking for sympathy. I think that is actually a real stretch.
Yeah.
I think this kind of goes with the fact that nobody trusts anything anymore, and there's so many conspiracy
Hmm.
theorists out there, and unfortunately, facts. If you say something has happened, and if it doesn't, uh, if it's not in keeping with your point of view, that people think it's bias or it's fake
Right.
news. I mean, it's really a bad situation in this country. But you know, so I don't even think we should entertain that conspiracy theory or that theory at all. But I do want to
Hmm.
talk about you talked about mixed messages at the very top of this conversation, Jake. And I'm talking with Jake Deutsch, everybody. And someone said turn up off the comments, but I actually really want to keep them going. So if you guys have a question for Jake, you feel that you can ask them. So please, ask me questions, and I will
You're
get them
you're
to.
good at reading all of those. It's
I
really
mean,
hard. There's so much.
I'm I mean, they say multitasking isn't really a thing, but I'm somehow able to look at these comments and questions, and try to deliver them to you. But what I wanted to ask you, Jake, which I thought was so interesting, in two separate tweets, the president contradicted himself. He said, "I've learned something." I'm paraphrasing here, everyone. "I've learned a lot about COVID." Which may say he understands how serious it is. And then he said, "Don't worry about COVID, everyone." I should probably get the exact tweets. Adriana, do you have those exact tweets? That So he basically is sending two very different messages to the American people. So what do you think, ideally, and nothing seems to be ideal in this current situation and our current culture and our current political landscape, but what would you like to come from this, from the president, that
Mhm.
he understands that this can be quite debilitating and people need to take precautions, particularly given that 23 states are reporting upticks, Jake, as you know, in
Mhm.
New York City too.
Yeah. So, I mean, that comment was so inflammatory to myself, having had COVID, having taken care of thousands of people, having, seen the senseless loss of life associated with this virus. We had 209,000 people in the United States that have died. So to say don't worry about COVID just undermines the seriousness of everything that we've endured. And, I would love for him to have turned around and said, you know what? Guys, I now see things a bit differently. Luckily I'm doing well. And that doesn't take away for the thousands of people who have died, hundreds of thousands of people have died. That doesn't
Well,
diminish,
211,000 in this country alone.
right? That doesn't diminish the loss of jobs that have occurred because of this, the lack of healthcare that has, transpired because of this. If there was a little bit of acknowledgement, like, hey, don't worry about me, I'm doing okay, but I've had a little bit of an eye-opening, even a little bit, so that people would, be able to relate to it. I just think it's so unrelatable. I mean, if somebody in your family has died from this, how could you have any sort of connection with somebody who says, don't worry about this? And if you have no access to healthcare, how could you have connection to somebody who is being medevaced into the hospital and getting experimental treatment? And if you've lost your job because of COVID, and you can't even afford to see a doctor, how can you relate to somebody who says, don't worry about COVID? It's so disconnected from reality.
And by the way, for the person, the follower who said those numbers aren't accurate, actually, that assertion is not accurate. There was a rumor online that it was a much smaller number because in some cases, and you can speak to this, Jake, comorbidities were listed in cause of death. And
Hmm.
if there was, pulmonary problems, or what
Right.
is it called?
Diabetes. Right.
Yeah. And what are some of the, like, when you have massive, like, respiratory
You have
problems?
emphysema, if you have asthma, if you had underlying medical conditions like diabetes or kidney disease, but that doesn't discount the fact that they were infected with COVID and subsequently died as a result of that infection. The comorbidities are real, and we understand that that puts you at higher risk, but it doesn't negate the death.
No,
And
also doesn't make the numbers illegitimate. I think the point that people need to understand is that was going around, spreading like wildfire because underlying conditions in some cases were written in under cause of death. But for everyone who thinks those numbers aren't accurate, you were actually extremely wrong in this case.
And one death is enough for this to be serious. I mean, when it's your family, when it's your spouse, when it's your child, that number, it doesn't matter if it's 1 or 200,000. And, look at the statistics relative to other countries. The White House has more cases of COVID in it than does Australia, than New Zealand, who have zero. Just speaks volumes to relative ability to handle this infection. And, what's more real than that happening right now?
And I want to read the tweet that the president tweeted just, when was this? This was at 2:37 this afternoon. I will be leaving the Great Walter Reed Medical Center today at 6:30 p.m. Feeling really good. Don't be afraid of COVID. Don't let it dominate your life. We have developed under the Trump administration some really great drugs and knowledge. I feel better than I did 20 years ago. When we're talking about mixed messages, that's what we were talking about. And then, I think that he has tried very hard to project an image of strength and the fact that he can get through this. What is that?
Just the idea of feeling better than I did 20 years ago. I mean, I don't know any patient who had moderate disease who can state that they feel better while they're still actively infected with COVID than they did 20 years ago. It's not congruent with what we've seen with this process, with the actual illness. So I have such a problem with that type of language and that type of assertion.
He also just tweeted at 6:23, we'll be back on the campaign trail soon. The fake news only shows the fake polls. What kind of issue does that present to various people in this stage of the infection, for the president to interact with people out on the campaign trail, not wearing a mask, for example, as he hasn't been doing during the pandemic? Is that concerning as a medical professional?
Yeah, he's still in considered what would be a contagious phase. So at a week, he's not yet cleared the virus significantly. We see test positive up to a month after infection. So, he'll still be testing positive. We don't believe that the virus is significantly transmitted after 14 days and now recommended 10 days of isolation and quarantine for a mild to moderate infection. So he's still in a window where he potentially would be highly infectious. And, it's the wrong message. The Secret Service who are in the car with him, they're basically rolling the dice. They're assuming that those masks are adequately protecting them. I mean, the one thing that we do know is masks work. I can say that from my own experience, from my practice and the staff not getting sick once we started to use masks, but they have to be used consistently.
Right.
But going out on the campaign trail and taking off your mask is in my mind, malpractice.
I was watching PBS before we got, when I was channel surfing, and they had a doctor on who said basically the Secret Service agents had masks, they had protective eyeglasses, I guess goggles on, and that was fine. This was some doctor, I wish I had gotten his name, from some World Health Organization, and he seemed to be overly concerned. On the other hand, an attending physician at Walter Reed tweeted earlier today that it was insanity for the president to put the Secret Service agents in that kind of position and that they'll need to quarantine. He said all for political theater. And
Right.
so I'm just curious how you would assess those two very different views of the president's drive-by, basically to say hi to his supporters outside Walter Reed.
Well, let me explain from a medical perspective. If we have a patient that we know is COVID positive, we use the protective equipment to minimize the risk. But of course, we still know that there's risk. But that's associated with having to treat the patient. Assuming they're admitted to the hospital, they're critically ill, you still need to have people care for you. And those healthcare workers understand that they're taking those risks and putting their life on the line as part of their duty to, protect and treat that patient. Being exposed to somebody unnecessarily, is not what is equivalent to treating somebody in the hospital. I mean, I guess the Secret Service are looking at it as they would put their life on the line for the president, and in fact, that's what they're doing. But once it goes beyond that, once it's outside of his direct bubble, if he's on the campaign trail and he's in proximity to people and, he's enforcing not wearing masks, then you start talking about the recklessness and the possibility for people getting sick.
There's breaking news from the New York Times. The White House has refused to accept proposed new FDA guidelines that could delay an emergency vaccine approval until after the election.
Right. And the whole grandiose claim that we're going to have a vaccine in a couple of weeks, just so frustrating when you understand what really needs to happen for a vaccine to come into play. And even his tweet this evening that we've developed so much under his administration, there's nothing that's FDA approved that's generally being used for the public. So, that's just one more layer of misinformation. Again, everything is a bit cloudy.
It's pretty stunning that they're refusing FDA guidelines. Let me read the just first part of this article for everyone. The struggle over the guidelines is part of a months-long tug-of-war between the White House and federal agencies on the front lines of the pandemic response. White House officials have repeatedly intervened to shape decisions and public announcements in ways that paint the administration's response to the pandemic in a positive light. This is really, really concerning.
Sure. I mean, they're trying to circumvent the natural or the required processes to get a vaccine approved with safe, proven methods that would, traditionally be used.
Yeah. Well, what kind of treatment? So who knows if he will be quarantined in the White House? I heard someone report tonight that he is maybe going to the West Wing and interfacing with some staffers there. I have no idea, and hopefully he'll ask. Hopefully he won't do that at all. But
Right.
Will he stay on remdesivir? Did I say it right?
Remdesivir, you're getting closer. Yeah, 5 days for that. So that's a 5-day treatment that he's receiving for that. The steroids would probably be about 5 to 7 days, depending on his progress or conditioning changing. And the monoclonal antibodies, I'm not clear on what that protocol is. Again, there's not any FDA approved therapy there. I would assume it's probably 5 to 7 days as well.
Interesting. Well, it's been a crazy year, but certainly a very crazy. I mean, there have been so many crazy days and weeks in this strange year. And I guess, anything else? If you guys have any questions for Jake, he explains things so well.
Thank you.
And
I mean, just to put it in perspective, I mean, I've been a doctor for 25 years, and I'm an ER trained. I've seen so many interesting, crazy, challenging life and death moments, and nothing in my career has prepared me for this pandemic. And to be part of that and to have the privilege to take care of people is really, something in my mind that is never going to be surpassed in terms of just fulfillment and just what it means to be a doctor. And on the contrary, I see so much that contradicts that is the exact opposite of what I've experienced and want to try to educate people with, because this misinformation. So I think it's very important that we use our voices, that we communicate what we think is important, even if it's not what's getting onto the 7 o'clock news, and really stick to science. So that way we can continue to fight this and make progress despite the lack of information being transparent.
I mean, I couldn't agree with you more, Jake. We need to listen to the experts, to the scientists. And there was a trend even before this to be skeptical of scientists and, I think be skeptical of expertise. And I think it's a very stupid thing to do, because these are people who are studying these issues day in and day out, and we have to respect them and really understand that they are giving us the best advice they possibly can. I don't know
Absolutely.
anything else to talk about except for this is just seems crazy to me. Any other? Oh, I wanted to mention the experts are being muzzled. I wanted to mention that we're going to have highlights from our conversation tomorrow in my newsletter. If anyone wants to kind of hear some of the things that Jake had to say, you can subscribe to the newsletter by going to katiecouric.com. It's called Wake Up Call. It'll be in your inbox every morning. And we are actually, oh, I wanted to, thank you. Someone just reminded me. I wanted to briefly explain what the VIP syndrome is because this
Oh
has
yeah.
been written in medical journals. I'm going to try to explain it and you tell me if I've got it right.
Okay.
So there's a VIP in a hospital, you guys. Then it puts a lot of pressure because it becomes a very public thing and it puts a lot of pressure on the doctors and the attending physicians, et cetera. And sometimes they don't use sort of what is their best instincts in terms of how they would treat a patient because they're worried. And so they overthink situations and they may do things that are not necessarily in the in the patient's best interest. And similarly, they could also defer to the patient too much because if that patient is someone like the president of the United States or married to a TV news anchor, they might feel that they defer to that person too much. And
Mhm.
so I've heard a lot of people talking about the VIP syndrome vis-a-vis the president at Walter Reed. And I'm curious if you've seen that in action, Jake, and
Of
if you
course.
we might have seen that playing out a bit with the president's hospitalization.
Yeah, of course. I mean, when you're practicing and you get a call from an administrator that says, I have a VIP that's coming in because they have X, Y, or Z problem, all of a sudden your flow and how you're treating people changes. Recommendations change, accommodations change. On every level, there's just a change that can potentially transpire that's going to affect the outcome of the treatment, and may sort of take you off course from what you would normally do. I've taught a lot of medical students and residents, and I always explain you got to be consistent. It doesn't matter, if it's late at night, if the patient is difficult, if they're, VIP, you have to just have that consistency so that you don't get into those predicaments that's going to be bad medicine. And when it comes to VIP access, I think that that's very clearly an effect. Certainly, the access to experimental treatments is a reflection of that. Being able to be let outside of the hospital, when he still wasn't considered to be stable, those are the type of antics that play into this VIP syndrome.
Right.
And really, you don't want that. Whenever I have a family member who's sick, I don't want to treat them because your sense of perspective and your judgment is going to be skewed because it's a family member. And it's the same idea when it's a VIP and there is pressure to treat them differently than any other patient. So yes, we have to take extra precaution because it's the president, but we can't be losing our clear direction of how to practice good medicine because of that.
And I wish that the president's doctor, I think he lost a lot of credibility because I think he said he didn't withhold information, but it certainly does not appear that he was very forthcoming when he talked about the president's condition and information that would have, I think, helped the American people understand the extent of the virus and how he was doing. So
Of
anyway,
course. Of course. Well, I think that simplifying this information, being clear, it's very when there's an agenda attached to it, it becomes even that much harder. So, I can't even imagine the pressure he was on to paint a certain picture or to convey a certain sense of calm. So again, it's the VIP syndrome affecting the way the doctor is communicating.
it seems like he fell victim to the VIP syndrome. And by the way, there's a long history of misinformation or lack of transparency when it comes to presidential health that we saw with FDR, Woodrow Wilson, John F. Kennedy, who was on steroids, and for Addison's disease. So there's there's a lot of precedents for this, but you just hate to see it happening in 2020, and that you would hope people would learn from past mistakes. A couple people asked about the impact, and then we'll go, because I know you've got to go, and people are probably getting tired of this anyway, but my husband's calling me. Doesn't he know I'm doing an Instagram live with Jake? But the impact of steroids on your judgment. And I'm
Hmm.
curious if that could have happened, because
I mean,
I was on
steroids are,
steroids.
yeah, I mean, steroids are one of the most powerful categories of medications, and they affect our endocrine system, our metabolism. Um, I see many times patients have insomnia because of them. They feel a sense of anxiety. They're, just in a hyper-metabolic state because of them. Diabetics can't take them because it makes their blood sugar rise. There's just a cascade of problems that could be attached to taking steroids. So that would be one concern in terms of performing duties. But I
Mhm.
just, you got to talk about the other real symptoms of COVID, the brain fog, the fatigue, the headaches. Those are real symptoms and debilitating for many people that potentially could be affecting his function. So, I'm very concerned. Having had COVID, when I was sick, I checked out. I was out for 2.5 weeks. I didn't see a patient. I wasn't doing anything in terms of like medical decision making that would have been critical because I was really debilitated.
Yeah, I thought it was interesting that I don't know whether it was a tweet or the doctor, the White House doctor said he wasn't experiencing any fogginess, or I thought that was
Right.
interesting that they pointed that out specifically. So
Yeah.
and
Subjective, that would be a subjective report. But, did he have any neurologic testing? Was there a consultation by a neurologist who, looked at some cognitive function there? That's again, I think, painting a rosy picture.
yeah. Well, listen, thanks so much for spending some time with me, and for everybody who was watching. It's just
Thank
nice.
you.
There's so much, as you said, there's so many mixed messages, so much conflicting information. A lot of this medical stuff is very confusing for people who don't have medical backgrounds. And
Mhm.
of course, we haven't even touched on the political politicization. I can't talk tonight. I've been drinking. I've just had a busy day. But please subscribe to my newsletter. Jake, let's do this again. And of course,
I'd
you
love
know,
to.
want the president to get well, but we also don't want people to be at risk. And we want him to be a good example for everyone else in terms of what kind of behavior they should follow. So
Absolutely.
thanks for spending some time with us, Jake,
My
and
pleasure.
for watching. We appreciate it. No, I'm not
I
drunk.
was
Someone
I was
just
just I
drunk.
was just gonna add I was just going to add, this is such a good forum to, get information. Many people don't watch press conferences or aren't watching, the news 24/7. So I really applaud you for taking this opportunity to use your voice, and hopefully we're getting good information. I'm doing the same on my social media. I really think that it's important that there is some clear information. I love clinical medicine. I love taking care of patients, and having a conversation with a patient and explaining something clearly is so important to the process and healing. And doing that on a bigger scale just makes me very happy and fulfilled to be able to bring that to people. So thank you for having me on tonight.
My husband must really want me, because he just called me
Something
again.
important.
So, it is so important, and I could go on and on about people not trusting information and being in their own echo chamber and getting affirmation instead of information. And it's super important that we have. This is a public health crisis. That's why we really need to give accurate information, especially as we get into the colder months and we're seeing an uptick in coronavirus cases in so many states. Okay, I'm done, Jake. So good to see you. Thank you so
Great
much for
talking with
your time.
you.
Okay, bye,
Anytime.
everybody. Have a
All
good
right.
night. Okay, bye.
Good night, everybody.